Blood collection, we take the blood out of the jugular vein 99% of the time. The jugular vein lies along the neck in what's called the jugular groove, and it's very close to the surface of the skin. So you don't stick the needle straight in to get to the jugular. You're going to slide the needle a bit alongside the skin. So you go in at maybe about a 30-degree angle. To collect the blood, we always insert the needle towards the horse's head. Some veterinarians, when they give injections, like to insert the needle away from the head, because that's the direction the blood is flowing in the jugular. The jugular is a vein, right? So where is the blood going to that's in the jugular vein? What's the next place it ends up?
The heart.
It goes to the heart. So if you're giving an injection, you want to inject it towards the heart because the blood's going to be mixed, and that means that the drug is going to be mixed in the largest volume of blood before it's distributed throughout the body. But for blood collection, we insert the needle towards the horse's head. We're going to use a vacutainer system today to collect the blood, and this is what color of a top? It's red, a little bit orange, but it's called a red top tube. The red means there's no anticoagulant in it. So after we've collected several of these, you're going to be able to go over and see, and you're going to see the blood is clotted inside. And the clear liquid from clotted blood is called serum. So that's how you would get a serum sample. If the vacutainer had a green top, that means there's a little drop of heparin in the bottom of it. Heparin is an anticoagulant, and that blood would always be free-flowing if it had heparin in it. Even 2 hours after you collected it, you'd be able to tilt the tube back and forth, and there'd be no blood clot. It would just flow back and forth. In order to get the yellow liquid out of heparinized blood, you have to put it in a centrifuge and spin the red blood cells down to the bottom, and the yellow material at the top is no longer called serum, that's called plasma. So the difference between serum and plasma is that your blood clotting agents are still contained in the plasma, but they are in the blood clot of serum. They're absent from serum. So that's our big difference between serum and plasma. So use a red top for serum, a green top for plasma. Now, sometimes the veterinarian wants to collect a blood sample to actually look at the red cells and evaluate them and do what's called a complete blood count, or a CBC. And for a CBC, you use a purple top tube. And the purple top tube has an anticoagulant in it called EDTA. And EDTA will preserve red blood cells in a better format than heparin will, so the red blood cells can be examined under a microscope for their integrity. So those are the three main types of vacutainer tubes that we would use for blood collection: a red top, a green top, and a purple top. Now, so these tubes are under a vacuum, and that means that once the needle end gets inserted into it, if the opposite end is exposed to the air, you've just let all the vacuum is gone and air has now come in. So you want to be very careful that when you puncture the top of the vacutainer tube, the opposite end is in the horse's neck, so that you're not allowing the air to come into the vacutainer. So the vacuum in here is what actually draws the blood into the tube. So you'll see that when I actually take the sample. So the vacutainer needles, the needles we use to go with the vacutainer, have two ends on them. They have the traditional needle end with a beveled edge that goes into the horse's neck, and then it has another end that goes into the vacutainer tube. And normally you would assemble this by putting, there's a little screw, tacked end screw here in the yellow, that would screw into a plastic shield, and that the vacutainer would fit up in. We don't have those shields today. Dr. Pidherney couldn't get any of them for me, so it'll be a little bit trickier on how you work this, but we'll be here to help you do it. So we take the ends off the vacutainer needle, and we have you want to make sure this end is sterile, the needle end. You don't want to touch that with your fingers. And on the other end is a little rubber sleeve. I like to pull that off right at the start, stick that in your pocket, and just hold the needle by the yellow plastic hub. When you insert the needle into the vein, you want to put, this is a beveled edge, and so you want to put the pointy end in first. So you're going to have the open part, the beveled edge, facing you. So then I'm going to take my little 4x4 that has some alcohol on it. And so make sure you guys can see. So come on around to this side if you want. So we'll try to clean her neck a little bit. Okay. And so the jugular, this is a jugular groove. You can see the indent along there. So you simply put your thumb under where you're going to stick the blood sample in, and hopefully you all saw that this area filled up. It's no longer an indentation. It's filled out. The jugular vein is probably about ½ an inch around, so it's a pretty big pipe that you're gonna hit in there. So you take your beveled needle and you just insert along. And I already hit blood. Support the end of the needle, and it's filling up with blood very nicely. I like to put my finger over, and I just did what you shouldn't do. You can tell I do this so quickly sometimes. You want, because there's a vacuum in here, you don't want to pull this needle directly out while it's attached to the vacutainer, because that pulls a little vacuum on the vein. So what you should have done, what I didn't do, was to, so again, support the needle in the horse's jugular and disconnect the vacutainer tube and then pull the needle out. So I did it wrong, and I'm sure some of you will too. Blood. Okay, so any questions on collecting the blood sample? If this had an anticoagulant in it, you would want to do this a couple times to make sure it mixed. But this will be a serum sample, so I'm just going to sit it aside and it will clot. So any questions? Nope. Okay, so you can stop.